Tonight, coronavirus cases continue to rise throughout the region and around the country. And here in Oregon, some counties now preparing for a 2-week pause starting Wednesday, required by the governor. And now 4 more counties have been added to that list. It is 10 o'clock. Good evening, everyone. I'm Jeff Gianola.
And I'm Elizabeth Din. And so with all this comes promising news, though. The drug maker Pfizer announcing today its trial vaccine is 90% effective.
And Jenny Young talked to state health officials about what this means for you and your family. She joins us live tonight. Jenny?
Jeff, Elizabeth, well, this news from Pfizer is from early and incomplete reports, but state health officials say it gives them a big boost of optimism.
We were elated.
Dr. Joe Sullivan describing the reaction among his colleagues at the Oregon Health Authority as scientists inch closer to a major breakthrough in the fight against coronavirus.
The FDA said that they would accept or consider a vaccine for an emergency use if it was only 50% effective. So the fact that we have a potential 90% effective vaccine is incredible.
Leaders at Pfizer saying on Monday their vaccine is looking to be 90% effective, and they're on track to apply next month for emergency use approval from the FDA.
This is really good news. It's the first demonstration that a vaccine will work in humans.
Dr. Lewis Picker with OHSU has spent the last 20 years working to develop an HIV vaccine.
To be perfectly honest, it is the HIV vaccine effort that led to this, because many of the technologies that are being put forward as SARS-CoV vaccines were first developed in the context of HIV.
He explains while the news from Pfizer is promising, it doesn't mean a vaccine is imminent.
This is a little over half done for the trial.
Picker says getting FDA approval is only the first hurdle.
The other hurdle is to manufacture enough doses so that it can be distributed. And we're not talking about 1,000 or 10,000, or even 10 million. We're talking about 1 billion doses.
So what happens when a vaccine does hit the market? How long before you and your family are able to receive it? Right now, public health leaders don't have a definite answer.
There's going to be a phased rollout. Initially, it'll be limited vaccine, and that people will need to continue to do the common sense things like wear face coverings, social distance, avoid gatherings with groups, except those people who live in your household, for a while. But there's hope, right? We're in a lot better place today than we were yesterday.
All right, so as you can hear, he's optimistic, but they are still concerned that if people do not follow these safety guidelines, numbers will continue to rise, especially given that Thanksgiving is coming up. They are asking that you rethink your plans and only get together with people in your immediate household. If that's not an option, they say do not get together with a group of more than 6 to 10.